Well, thank you for the welcome. Thank you for having me at the Florida Healthcare Association Annual Conference. Before I get into my substantive remarks, I know you will all join me in saying that, after the events of the weekend, Florida stands united with our friends in Texas and Ohio. And we are not going to tolerate that here in Florida. And I'm so fortunate to be able to work here in Florida with a lot of great first responders, and you saw it, some of the people who were putting their lives on the line. We have done an awful lot since I took office. If you look across the spectrum, we did probably more on education than has been done, certainly in the past 20 years, maybe in modern times. We did more on water quality, environmental support, and Everglades restoration than has been done in a generation. But we also did that within the context of a budget that, even though we are doing these historic investments, we reduced taxes $400 million and have a budget for a state of 22 million people, which is roughly half of what New York State spends in their budget, and actually is less than the budget of New York City. And so we are meeting the challenges that are faced with the state, but doing it in a way that's actually fiscally sustainable, and I hope self-reinforcing. As we maintain a healthy economic climate, we have our ability to attract more investment into our state. That expands our economic base and then gives us the ability to meet challenges as they come ahead. So I think if you look at Florida's trajectory versus some other states, I think we're going in a good trajectory, and I think that's as a result of making good decisions. One of the things, though, that I think we did very well this past session, and I know you guys have to deal with it, is in the sphere of healthcare, we really need to find new ways to innovate and come up with new innovative solutions to deal with the problems that affect so many Floridians. And so we were able to do probably as much as I can remember in just this one session on things that will really hopefully have a significant positive impact on folks throughout the state. One of the things, and there was just in the news recently that we did, was try to get relief for folks for pharmaceuticals and prescription drugs, which have been extremely expensive for an awful long time, more expensive here in the United States than anywhere else in the world. And obviously, it was something that I wanted to deal with, but it's like, how do you really deal with it at the state level? Obviously, a lot of this stuff is tied in with federal policy, and the federal government really runs a lot of the stuff in terms of drugs. So, we had the Speaker of the House, Jose Oliva, really felt strongly about it. He came to me and said, if the state of Florida could just buy the pharmaceuticals just for our prison in other countries, the same drug, we would be able to save tens of millions of dollars. And I'm like, yeah, and just imagine if consumers had access potentially. And so, he had ideas of really pushing forward. I had to look, I guess, say, okay, well, is it something that we could actually do that would potentially have a benefit, or is this kind of us just saying, we don't like the way it's going, and more of making a political statement? And look, sometimes you need to make a statement. So I'm not saying you can never do that, but I really wanted to try to figure out, is there a pathway to actually realize savings for people? And so my folks were looking at it, and we identified a provision of federal law from 2003, which had never been utilized, but basically allows the federal government to approve purchasing pharmaceuticals from Canada. So you can get the same drug there for a fraction of the price. It had never been implemented or approved, I think for obvious reasons, because there's a lot of lobbying muscle behind keeping the status quo. I think of any lobby in Washington, certainly pharmaceuticals would be close to the most influential, if not the most influential. And so it had just never been something that had been utilized. So I was like, well, you know what? I think we may have a better shot at it this year. So I went early in the administration to Washington, met with the president, showed him kind of how this could save. We just took 10 pharmaceuticals that we do in the prisons and showed the difference and showed the overall savings. And to his credit, he said, yeah, he's like, if you can get cheaper drugs, you should be able to do it. But it shouldn't just be the state of Florida. I think anybody in your state should be able to have access to that. And so he basically said, this is a pathway, that I would be very receptive to if you guys choose it. And so we ended up they ran a bill through the legislature just to provide some kind of context on it. And you had a lot of commercials being run and everything. If you just turned on your TV, you would think that we were really intent on bringing drugs in from Djibouti so that everyone would get killed. I don't know why people would believe that. I don't think very many. Actually, people didn't believe it because it was like, I think 75% supported it after like $15 million in ads saying it was a bad idea, and went from 75 to like 82. So it was, it actually increased in popularity. So we went through that whole process, came up with it. But even still, you have a situation where just because, even though the president calls the shots, you got people in the administration who may want it, not want it, have different agendas, try to figure out a way to maybe put the brakes on this thing. So I had to go up again, and we had another meeting, and basically the president told his folks, like, we need to find a way to get this done. And so recently they came out with the initial guidance, and we had been working with HHS on what our government plan in terms of what we were going to do for the drugs we buy. Obviously we want the private to be able to do that too, but we did that, and they basically said, we're going to go forward with these demonstration projects. Here's a template that you should use, and they recommended they're using the same template was based off what we had been submitting to them. So this is going to take some time. There's going to be some regulations or whatnot, but this is, I think, the beginning of a change in how this whole industry's been operating, to where the United States isn't necessarily going to fund pharmaceuticals for every other country in the world anymore, that we expect to see some savings for our patients and consumers on our end. And so stay tuned on that. But I think that's an example of, okay, we understand the status quo. We understand that there are ways in which that's not servicing the needs of our folks or taxpayers. And so what can we do? And so we found a provision of law that we could hang our hat on. We moved forward. President was receptive, and now we got to kind of put it into practice. But I'd much rather have that opportunity than not have that opportunity. And so hopefully that will end up being implemented in the relatively near future. This is Washington we're dealing with, so these things don't happen overnight. Our analysis just for the state of Florida, and look, this is a static analysis. Behavior will probably change, once the rules change. But on a static analysis, if you just look at what we bought, and if we had access to a foreign market at cheaper prices, it would save the state of Florida $150 million a year, just for Florida taxpayers. That's not even saying what it would be for the run-of-the-mill consumer who's paying for this out of pocket. And so I think that that's a good thing, and I'm hoping that many of you in this room will be able to benefit from that. Another thing that we did was look at the overall costs of insurance and health care, and how that's just been a constant problem. It seems like it hasn't abated for years and years. And at the end of the day, when you go in to get medical services, if you have an insurance policy where a third-party payer is paying for everything, how much it costs is really not anything that the consumer is involved with. It's the insurance company charges one thing, then they give something else, and it's kind of this big shell game. Well, we wanted to say, okay, is there a way to have the consumer have a little bit of say in this? Because if the consumer is looking to see what makes sense financially, if they have an ability to benefit from that, that could create different incentives to where no one cares about cost, to now where the average consumer is incentivized to care about it. So we enacted, and Florida had previously enacted, although it hadn't been implemented when I got into office, and so I issued directions to speed it up, a price transparency portal. So you can go on and see how much a certain procedure would cost, if you go to a hospital, if you go to a surgery center, or what have you. And that would be published. Now, you look at that, if it's just going to be paid by a third-party payer, then it probably doesn't matter to you either way. And so it was good to have the price transparency, but how are you going to be able to utilize that price transparency in a way that would put a downward pressure on prices? And so what we enacted, and it'll take some time to implement, is something called patient savings, where if you have an insurance policy participating in a shared savings plan, you go on the portal, see that you can get a better deal somewhere, and then you make that decision to get a better deal. Well, the money's just not being saved by the insurance company. You then get some of that rebated to you in the form of rebates on your premiums. And so then you now have an incentive to look and make good decisions, and if you do that, then you will have a benefit. It's been done with our state workers on a very limited basis, but they've already saved the state, I think, almost $2 million in a relatively short period of time, and obviously the individual patients will save as well from that. So this is a model that's in its infancy, but I think is a good innovative solution to trying to figure out a way to address some of the rising costs. Another thing that we did early on was recognize, if you look at Florida's population and the demographics, and obviously many of you here are well aware of that, we have certain diseases or public, health care issues that are more pervasive here than in some other states with different demographics. And one of the things that, of course, we know is really significant here in Florida is Alzheimer's and dementia. I mean, we have over 500,000 people in the state of Florida that live with Alzheimer's disease, and that's expected to increase to almost 750,000 by year 2025. And so we looked at that and said, you know what, the Alzheimer's was not even part of our state health plan, and so we put that in there as being a priority, and I directed the Department of Elder Affairs to make this a priority. And so our health improvement plan now has Alzheimer's as a priority. We also had our Department of Health apply to be a center of excellence for the Federal BOLD Act, which will again help Florida be in a position to pursue and receive grants for evidence-based approaches to treatment and prevention of cognitive decline. And so there's a lot of money at stake here. Obviously, we want to be able to do that. And then we also did more research funding for Alzheimer's disease. And so we want to do what we can, obviously, to participate in ultimately finding a cure for Alzheimer's. But short of that, we want to make sure that Florida is a place where we have caregivers that are able to help people cope with it, and to make Florida a place that, if people are afflicted with dementia or this, that they have, resources to be able to live as productively as they can, particularly into those early years. So I think that that's something that was overdue, and I think we've got a lot of momentum going forward. Now, I know that many of you here, have a lot of different concerns about some of the things going on in Florida, and I just want to say, I'm open to, ways to do things better. I want to innovate. I want to figure out the best way to deliver, this health care to our Floridians, but particularly our senior citizens. And one of the things I know that's been problematic is lawsuit abuse. And I think that we should do tort reform in Florida. I think it would save people a lot of money. And I think it could create better incentives. And look, there's a need to have legal disputes from time to time. But I think when the system doesn't work well, it's when you can bring a lawsuit, even though the person who gets hit with it is innocent. They know it's going to cost a certain amount of money to defend it, so they cut a check less than that just to have you go away. That is not a good system. I mean, if you did something wrong. If you did something wrong, that's one thing, but just imposing those costs for folks that didn't do anything wrong, but then having to pay, just because of the way the system's set up is wrong. So I'm happy to be here. You're going to be hearing from some folks that I have the pleasure to work with. I know Danny Burgess is here for the Florida Department of Veterans Affairs. We're working really hard across a number of veterans issues, one of which is suicide prevention and mental health, which is a very significant issue, and we were able to get some push forward with the legislature on some alternative therapies, which I think hold out some promise. You know, when I was in Congress, I'd have parents come to me whose kids were in the military. They ended up getting post-traumatic stress. The VA would just put them all on medication, and that does not work for everybody or even a lot of people. And some of these folks ended up committing suicide, and they believe that if there were other possible treatments, that would have been better for their kids. And so I started to look at it, and if you look, there's places around Florida that are innovating in this regard and are having success. There's Canines for Warriors in Northeast Florida. You have Veterans Alternative in the Tampa Bay area. So we want to embrace that, and I know Danny has embraced it. And I think you're also going to hear from Mary Mayhew, who's the Healthcare Administration Secretary. She's doing a very, very good job. Mary was actually overseeing all of Medicaid for the federal government. In the Trump administration. She was interested in coming to Florida. So for us to be able to get somebody who was overseeing Medicaid writ large to come down and do healthcare administration, oversee our agency here, that is a huge, huge coup. And so she's been working really, really hard on the prescription drugs, on Medicaid, and all these different issues that are so important. So we appreciate you inviting me, and we look forward to continuing to work with you guys in the years to come, because our senior citizens who are in nursing homes are an important part of our state, and we want to make sure that we have a system that's able to deliver them quality services. So thank you for doing your part. God bless everybody.
All right, one more time for Governor DeSantis. Wow, that was a fantastic speech, especially the tort reform part. Wouldn't you agree? Wow. Earlier this morning, a group of our Florida Promise members, nursing home owners, had a chance to have a breakfast with the governor, and they were able to relay some of your concerns. Really, I think we relayed all of your concerns during the breakfast to him, and he was very receptive and open, and we hope that this is the beginning of a really great relationship with Florida's newest governor. So I think I left off on introducing Team FHCA, right? All right, you ready to meet him again?